What is nitrous oxide, or laughing gas as it's called, and how is it used in labor for pain relief, or what is it even used for? That's what we're going to talk about today. So if you're pregnant and looking for alternative ways to manage pain, this is one that's pretty common, and Heather uses it at her birth center as well. So that's what we're going over. I'm Rachel Moises from the Mighty Mama Movement.
And I'm Heather, a family nurse practitioner and midwife.
So Heather, what is nitrous oxide and how is it used during birth?
Okay, so it is a gas that is used at the dentist office. A lot of times, laughing gas is its nickname. But there's a little bit of difference between what you get at the dentist office and what you get in labor. Okay. So at the dentist office, it's a 70-30 mix, 70% nitrous and 30% oxygen.
Okay.
And in birth, it's 50% nitrous, 50% oxygen. So not quite as potent. The other differences are at the dentist, you typically will have like a little nose piece, and it's a constant flow of laughing gas. Where at the birth center, it's either just a simple mask that mom holds to her face, or it's like a mouthpiece that you would breathe in. And the nitrous doesn't flow like oxygen would through an oxygen mask. You actually have to consciously breathe in and cause this, like an inhalation of it. You have to pull it through the tubing.
Okay.
And so with our machine, it makes this like a sound, and that's how you can know if it goes. I can tell when mom is breathing and taking it in. And she has to hold it herself. So in our facility, you can use it in the tub, you can use it wherever you want, as long as mom is the one holding it. And here's another thing, it's not continuous like the dentist office where it's just kind of nonstop. What we do is when moms say, I want to use it, then we have them breathe with the nitrous to kind of get it in the system. And they inhale it, and then when the first contraction comes, they've got some in their system, but they typically only use it when they feel that contraction starting.
Okay.
And then as soon as the contraction is over, they stop. Now, the trick is that when they're having the contraction, they're trying to focus and everything, so they don't want to put it up to their face. And we're like, no, like this is the time to use it.
Okay.
And so we have to be like, breathe the laughing gas, breathe the laughing gas. Because that's when they're trying to do different breathing patterns, to whatever pattern they have chosen to help with that relaxation. And we're like, okay, but this is the time to take it. Now, laughing gas has been used for over 100 years. It's been used for a very, very long time. I believe the Queen of England was one of the first to use laughing gas. I believe it was a queen. I think it was the Queen of England, though, that she demanded it and to help. So laughing gas doesn't take away pain per se. It changes your perception of pain. So when we have a mom that we call it climbing the walls, she has a lot of fear, she feels out of control, she's panicking, we'll give her the laughing gas, and what it does is it calms them down.
Okay.
It kind of removes fear from that equation. If you remember the fear, tension, pain cycle, right? You remove fear, it makes you more relaxed, which releases pain.
Right.
You don't feel pain. And so a lot of times after about, 10 or 15 minutes, 2 or 3 contractions, they'll say, I don't think this is working. And we're like, oh yes, it is. It is most definitely working, because with every contraction, mom isn't getting afraid and panicky. She's just dealing with the contraction, going with that flow.
Okay.
So why some women don't like it is it can make you definitely lightheaded, a little kind of like, woo, in the clouds,
Yeah.
You shouldn't be walking around with the laughing gas. You either need to be like in the tub or in the bed or on the birth stool, somewhere solid where you're not walking around that way. And I tell people, if you like it at the dentist, you'll like it in labor. If you hate it at the dentist, you'll hate it in labor.
Right.
So that's important for moms to know.
So what if you've never tried it before? I've never had a dentist before. Can you like try it beforehand, or just give it a shot for a contraction and see how it goes?
I mean, yeah, just try it I always tell moms, give it at least 3 contractions, because it takes a little bit to get the breathing, the way you have to pull it in. and all of that. And I'm like, give it about 3 contractions at least to kick in and see what it does.
See how you like it.
Right.
Okay.
Now, the safe thing about it is, so if you are pregnant and you're a dentist, a dental assistant, and a dental hygienist, and you're not supposed to be around people with laughing gas, but that's because you're around it all day long.
Oh, okay.
But in labor, it's fine because it's a concentrated period of time. It's not, all day for 8 hours every day kind of thing.
Quick side note, if you have a baby inside of your body that you're going to have to get out of your body, then I've got something I want to share with you. I'm a mama of 8, and my first 3 births were excruciating. I thought unbearable pain was just part of the deal. But everything changed with my 4th baby when Heather, the same midwife and nurse practitioner who's sharing her expertise with us here in these videos, taught me a completely different way to handle labor. I had never heard anything like it, and after I learned all this, I ended up dilating to 10 centimeters with 0 pain. And after 8 babies, I can tell you, this method works. The problem is most mamas never learn these strategies, and so even if they prefer to turn on an epidural, they worry that they won't be able to. Like my younger self, they believe that giving birth is incredibly painful and that there's no way around it without the drugs. I mean, I had done a ton of research during my first 3 pregnancies, but I never came across this method. I had picked up plenty of tips, tricks, and advice, but not a full-on low-pain birth method that actually works. After that birth, I never even considered getting an epidural again. I didn't need one. That's why Heather and I started teaching this, because birth does not have to feel like torture. If you want a practically pain-free birth, you can actually learn how to do it. It is not luck. We have a 10-step method that you can follow and maybe end up like Mumina, who recently told me that her twin birth was way less painful than her first singleton birth because she used this method with her twins. So if you're curious, make sure you click the link below and save your spot in our free online class, How to Give Birth with Practically No Pain.
But laughing gas gets out of the system in about 5 minutes. It is very, very fast that it gets out of the system, and for the majority of people. And so that's why you have to do it with every contraction, because by the time the next contraction comes, it's almost out of your system. You have to do it again. And that's why it's safer for babies than narcotics, Stadol, fentanyl, Nubain, or not Nubain, but some of the other ones that they use in labor. And the things they put in epidurals is because those have to go through the liver. Baby has an immature liver. It's not fully developed yet. And so as soon as they're born, now they depend on their liver to detox from the medication that mom has been given. Where laughing gas, as you breathe, that gets rid of the laughing gas. It's not relying solely on your liver to get rid of it. And so usually as a mom is pushing and we know that she's just a few contractions from delivery, we will stop the laughing gas, and because we know that it will be out of her system as she's breathing for baby. And then with baby, if there's any residual, it'll be out of baby's system very quickly once they start breathing. So it's very safe in that way. It's probably the longest pain relief that has been used for childbirth of all the methods.
And that continues to be safe with,
right.
It just seems like so many things you get new research and find out, oh, we're not doing that anymore.
Right. But it's been used for so long.
Yeah.
And so in the UK, they've used it just forever, for a very long time. Canada has used it for quite a while. New Zealand, Australia, they've used it. In the United States, in the past about 15, 20 years, it's when it's very slowly come in. And we were the first in Utah to use it out of anybody, all hospitals and everything for birth. We were the very first, and we still use it, but we actually don't use it as much as I would think that we would. We can use it for suturing afterwards. So if you have a mom who has a fear of needles, or, just after birth, you're like, I'm done. Why are you still touching me? Then the laughing gas can be really nice for that as well. So we'll use it for those things, I would say, more often. But yeah, we don't use laughing gas a whole lot. So
is it usually a situation of waiting till mom requests it? Or are you sometimes suggesting it and they're like, no, I don't think I need it?
So we do a little bit of both. So we give them the informed consent beforehand in labor. We have what we call at our clinic a 34-week packet that gets everyone ready for birth. And it's in there. And we tell moms, if you're not sure, just sign it, because otherwise I have to have you sign it in between contractions. So decide it. But then I do ask them, I say, okay, do you want me to bring it up? Or do you want to be the one to bring it up? And I have some moms that are like, I'm fine using it. I'll tell you if I need it. And I have other moms that are like, don't bring it up. Like, if I want it, I'll bring it up. So sometimes if a mom says that and I could tell it's something that could really help her, I will go to her husband and I'll say, okay, you know her better than me. She asked me not to bring it up. What do you think? And I kind of let her husband, her partner, make that decision on, in this case, should I bring it up or should I not? Will she get mad? That kind of thing.
Yeah.
Because you don't want to, Penny Simkin talks about the pain of labor and suffering in labor. And pain of labor, as we talk about, is not just physical, it's mental. And so it goes both ways. And so just trying to find what's right for each woman.
Yeah. So if you follow us, we talk a lot about practically pain-free birth, low pain birth, and a huge important factor of that is staying relaxed and being able to focus through your contractions. There's a really incredible technique that we teach in our free birth class, by the way, that if you haven't taken, you should. There's a link to it below. And so I understand that you're saying is that sometimes women get so stressed out or in their head that they're not being able to implement the things they've learned to handle the contractions in the way that helps them be low pain or no pain in a lot of situations. And so that's when this can be helpful to help you kind of get out of your head and relax and calm down and get to where you can be in control again, because you've just gotten to a point where it's too much for you.
Exactly.
Right?
Now, a couple things. A lot of hospitals have not implemented it because it's a whole new protocol procedure, which is, they have to do trials and they have to have things approved, and it's a big deal. With us, it was, I made a simple protocol and I implemented it, but I don't have to go through a board of trustees and I don't have to go through this huge, panel and everything. But one of the big reasons that we found that hospitals don't want to bring it on, besides the red tape that accompanies it, is your epidural rate drops when you have laughing gas on board. Because a woman who is kind of hitting that wall, she'll use laughing gas and 30 minutes later she has a baby. That transition.
It helps her push through.
Yeah. Right, it helps her push through. Where normally they would get the epidural. And even if you have the epidural for 3 minutes before baby is born, as soon as that process starts, they can charge
You're
for
paying
the
for it.
And so with laughing gas dropping those rates, a lot of hospitals are very cautious about bringing it on board because epidurals bring in big money. And a lot of doctors like the complacency of you being in bed, not being able to move, you can't fight, you can't eat, everything that goes with an epidural, the restrictions that we don't like, but they do like coming on board. So that makes it harder to push through that.
So that's a good way to think about it. For a lot of women, when they get to the point where they're thinking, okay, I just want the epidural, maybe instead try the nitrous oxide and see if that can help you push through that hard moment. And then again, start implementing the techniques and strategies you've learned to manage that. Because it's understandable to get to the mental place where you can't do the things, and it takes some effort to refocus and recenter, and look, this will help a lot with that if it's an option. So you said a lot of hospitals don't use it. So I don't know how to tell you how big of a factor is this in deciding where to give birth? Because we talk a lot about where should you give birth. It depends on what's important to you.
Right. Well, let me give you an example. So I had a mom that used laughing gas, and she literally laughed through most of her labor. It was hilarious. It was the best thing to see. And so they moved away. Her husband was in med school, and she was pregnant. So she did all of her prenatal care back east, and she flew out specifically because I was one of the few places in the country that did laughing gas. And this was, 15 years ago. So she flew out, had her second baby with me, so that she could use laughing gas.
So for her, it was important.
Yeah.
And it's hard to say how important it's going to be to you if you've never tried it before. But I think if you have the option to go somewhere that gives that option and you're really committed to having an unmedicated birth, it's a good tool to have around. I only have used it once, and it was really at the last minute, like right before I pushed to use it for a couple contractions. So honestly, I can't even say what effect it had on me, because it was at the very most intensive part of labor anyway. But
it was right before your baby was
yeah,
born.
especially if you've tried it at the dentist and felt like, yeah, it does help me. I do feel really relaxed and calm and like happier with life, you know. Then
I've used it for medical procedures. I've never used it for birth. It wasn't available in any of the places I gave birth. And so I have used it for medical procedures because I hate needles. Okay. I have like a massive fear of needles. I can give a needle, no problem, fine.
Poke somebody else.
Yeah, and I can even start my own IV. But injections, I have just a phobia of injections. And so a lot of times if I need like, you know, a cosmetic procedure or something, I will use the laughing gas because I hate being numbed. I just hate it.
Okay.
And that takes that fear and that anxiety down for me. So I've used it for that in the past.
Okay. Okay. So are there any cons about using nitrous oxide or reasons that some women probably shouldn't use it?
I had a mom recently who said she didn't like the laughing gas. And so I asked her why. And she said it made her lightheaded, dizzy. It made her feel like she couldn't concentrate the way she wanted to concentrate.
So she felt kind of out of it?
Yeah, okay. Exactly.
And that can happen. The good thing is, like you said, if you do try it, it's not going to stay in your system forever.
Exactly.
It'll be a few minutes and you'll kind of be back to your usual self.
Exactly.
And is there any circumstances where a woman should not use it because there would be a potential issue?
So if you have the gene mutation MTHFR, we've talked about it in other videos, you don't methylate or detox very well. And so laughing gas will stay in your system longer. And in order to help methylate laughing gas, you need B12. And so it will really drop your B12 stores. A lot of people with MTHFR have low B12 stores. And so being careful about that, or just somebody with low B12. So if your B12 is in, let's say, the 400s, it should be closer to the 1,000 mark for it. So a lot of times when we have a mom that is using B12 for an extended period of time, more than half an hour, that kind of thing, we will
using
give
the
her,
nitrous oxide?
I mean, yeah, the laughing gas. Yeah. Sorry, what did I say?
B12.
Oh, sorry. Yes, he's using the laughing gas. We will give them an injection of B12. So that we can kind of boost their levels. So people like that have MTHFR shouldn't use laughing gas for very long at all. They need to make sure they have B12 stores. So those are one of the
So if you're thinking of using nitrous oxide, you don't know if you have MTHFR or not, probably make sure your B12 levels are like, just be taking that supplement leading up to your birth.
The methylcobalamin, remember, not the cyanocobalamin of B12. The other people that it can cause issues with are those with sickle cell anemia. So anyone with severe anemia, but especially sickle cell anemia, because it depletes the oxygen. It's nitrous competing for oxygen that way. And so those people that are have that gene should not be using laughing gas. Okay. So those are a couple of the contraindications for using it. And you just, you need to be prepared. So B12, MTHFR, sickle cell anemia, those sort of things. Okay. You need to watch.
Now, is there a cost involved? Does insurance usually cover it if it's available? Is it something that do women have to be worrying about that? Like, oh, it's going to cost a lot more money.
Right. Some hospitals will include it with the cost. When it first came out, for many, many years, insurance would not cover it. There was an additional charge. I don't know the latest updates on that because it's been used in this country about 20 years now. And so enough hospitals may have fought for coverage. So I couldn't tell you there. I know that whenever we've billed for it, it's been denied. We keep the price very low for women because I don't want them to not use it because of cost.
Right.
So that's something to
So
consider
just
that
ask.
way. Yeah.
Ask your provider
Ask.
if there's an extra cost and what it is, but it sounds like it probably isn't too high. And it's not as high as an epidural.
Right.
I can tell you that much.
I know in the past I heard it was like $300 or $400 in a lot of hospitals to use it. So ours isn't that expensive typically. And so you're just going to have to find
something to find out so that you are prepared for that going into birth. So I just want to make it really clear, like we're talking about nitrous oxide, but a lot of people are interested. What is it? And it's a tool to help with labor. It's not like an epidural where it just turns off the pain. And it is not a substitute for good birth preparation. Like if you go into labor unprepared and you don't know how to handle contractions, and you don't know how to push, and you don't know how to deal with back labor and breathe, and just all the things to get your hormones going the way that you need them going to help with your labor, and the things to help your labor go smoothly, like the nitrous oxide is gonna just
it's not going to do much.
Not do that much for you.
Yeah.
But it's a really good tool if you've learned how to prepare for your birth and you get to a point where it's just getting really hard, and it can help you get over that little hump and then get back into your groove and finish out your labor peacefully and happily. So count that as a tool, as something that can help, but don't plan on that as this is what I'm going to do to have a low pain birth. And having said that, check out our free birth class because it will teach you all of this.